So for our assignment, what was the title of the assignment? Evaluation reflection for cervical and thoracic spine. I originally did have a patient during clinical come in with a back injury. I was hoping that it was actually going to be a cervical injury, so I could use this patient as this homework assignment. However, it turned out to be more of like a muscular spasm that occurred to his scapular, like right underneath his inferior angle of his scapula. So I decided not to use that and went with a mock patient instead for the homework assignment. Question 1 is, was my evaluation comprehensive? Why or why not? For the most part, I think my evaluation was very comprehensive. I would say so. I think I could have, excuse me. Whew. I think that looking at the SOAP note that I wrote down, I think I could have asked a little bit better, like, history leading questions. I think I could have maybe try to dig a little bit more into the patient's cause of injury. I know sometimes when it comes to neck stuff that I feel a little intimidated by it, but I think I should just get more comfortable with, asking leading questions and trying to gain that confidence through those questions. I did feel pretty good about testing range of motion and manual muscle testing, specifically bilaterally. I think that's one thing at my new clinical site that I've learned to do better because I constantly see them doing it. So I see it, so I implicate that. So I think that's one thing that I did really well for this. Question 2 is, did my palpation, inspection, and objective measurements lead to a confident diagnosis? I did my palpations and inspections. I do think it led me to a confident diagnosis. My patient did present with cervical impingement, which was what I thought it was. However, I think, again, like I mentioned earlier, I think I find the spine intimidating because there's just a lot that can go on with it. And just as an example with like my patient who came in with the muscle spasm from the scapular wing, like there's just a lot of surrounding musculature, and I think it can just be a little overwhelming. But I think if you ask the right questions and stuff, it can help lead you into a more confident diagnosis. So question 3 is, did I incorporate evidence into my evaluation? Why or why not? I performed 3 tests, compression, Sperling's, and shoulder abduction. Only 2 of those tests ended up being positive for the mock patient, which was compression and Sperling's. However, I knew that compression was a pretty good test. It will tell me it has a pretty high sensitivity, if I remember correctly. So that was one thing. I also was trying to keep note of, like, if I was experiencing a patient who in real life was dealing with this, I didn't want to put the patient in that much stress in case the patient might be experiencing muscle guarding or something like that. So I tried to keep that in mind when I was doing some of these special tests, because I might get I might not be able to perform the test to its full capacity. So yeah. Question 4 is, what did I do well, and discuss 2 areas. Well, 2 things I think I did well. I did a good job with getting to my diagnosis, and again, I think I did a really good job with testing those bilaterally. I know in the past that's one thing that I've kind of struggled, and so I've tried to keep it in the back of my mind. And sometimes when you get rushed through a evaluation, sometimes depending on how busy you can skip over it. So I think that's something that I've really tried to work on and try to remember to do. So I'm proud of myself for continuing to push and do that consistently. And lastly, the last question is, in what areas can I improve and how will I improve in those areas? Well, two things I can do better. I can always do better about not jumping to conclusions. I think when they start with a history, that was one feedback that I got from one of my preceptors was, letting the patient explain. And I think it's a little tricky with a mock, but with the patients that I have been experiencing and stuff, allowing them to express their concerns and stuff. So that's one thing that I know I can always improve on, and I just always want to improve that. And then secondly is asking history questions. Just asking more in-depth history questions on trying to get more information out of the patient. And then measuring range of motion. This mock patient didn't have any range of motion results that I could have measured, so I definitely would have added that to my areas of improvement for sure for this homework assignment. So